Okay, so let's imagine for a second it's the 1700s and you've got this toothache. What do you do?
Well, back then, your best option was probably a barber.
A bar bit.
Yeah, they'd pull out the tooth,
Mhm.
probably without anesthesia.
Ouch.
Yeah, exactly. Big difference today, though. We're talking algorithms diagnosing diseases before you even know you're sick,
Wow.
and 3D printing to make custom prosthetics. It's wild. Technology is revolutionizing everything about healthcare.
It really is. And that's exactly what we're diving into today in our deep dive. And a huge thank you to London Heartbeat's Z Academy for supporting this episode. They're doing incredible things in healthcare education. We'll tell you more about them at the end.
Looking forward to that.
So let's get into it. Well, we all remember those old medical records, right? Huge stacks of paper.
Oh, yeah, a nightmare.
But things have changed. We've gone digital.
Absolutely. Electronic health records, telemedicine, it's not just talk anymore. This is fundamentally changing how healthcare works. For everyone, patients, providers, you name it.
Right. And it's not just about convenience. This is the foundation for some truly mind-blowing advancements. We're talking AI, blockchain, the cloud. It sounds like science fiction, but it's healthcare right now.
And it's tackling some of the biggest problems we've got. Take AI, for example. It can look at massive data sets and spot these tiny patterns, trends, stuff that would take humans forever to find.
Just like a detective for healthcare data.
Exactly.
Yeah.
That means better diagnoses, treatments that are tailored to you, and even predicting and preventing diseases before they even start.
Wow, that's incredible. Now on to blockchain. It's not just cryptocurrency anymore, is it?
Absolutely not. In healthcare, it's all about keeping that sensitive patient data safe and managed. Imagine a world where your medical records are completely secure, but any doctor you allow can see them anywhere.
That's a huge step forward for both privacy and accessibility.
You got it.
And what about the cloud? It's more than just data storage these days, right?
Oh, for sure. It's like the backbone of modern healthcare. Healthcare organizations can use it to build their own apps, make data sharing smoother, and even run those complex AI programs, all while keeping everything safe and compliant.
So is it like the operating system for the future of healthcare?
Yeah, you could say that. And of course, we can't forget telehealth. It's really blown up, especially after the pandemic.
It has. It's been a lifesaver for so many people, particularly those in rural areas or who have trouble getting around. But is it here to stay?
Absolutely. Telehealth gives everyone flexibility and convenience, patients and providers alike. It's not meant to replace seeing your doctor face-to-face entirely, but it's a powerful tool we can use to give more people access to healthcare and get better outcomes.
Makes sense. And all this connectivity and data sharing brings us to interoperability. Can you explain what that means and why it's important?
Interoperability is about making sure that different healthcare systems can talk to each other seamlessly. It's like a universal translator for medical data. So no matter where you go for treatment, your records can follow you without a hitch.
That means no more lugging around those stacks of paper files or having to repeat the same tests over and over.
Exactly. Interoperability means better decisions, fewer mistakes, and ultimately a healthcare system that's more coordinated and efficient.
It sounds like a win-win for everyone. But all this tech stuff is great in theory. How's it actually being used to improve healthcare today?
We're already seeing real-world examples in a bunch of areas. For example, in disease diagnosis and treatment, AI is being used to analyze medical images like X-rays and scans to help doctors make quicker and more accurate diagnoses.
So instead of just relying on the human eye, AI can spot those subtle patterns that a doctor might miss, which leads to earlier detection and better treatment.
Exactly. AI can also help personalize treatment plans based on a patient's genes and lifestyle. It's a much more precise and effective way of practicing medicine.
Wow, it's like having a healthcare plan designed just for you. What about medical imaging? How's technology changed that field?
It's taken it to a whole new level. Now we can create these incredibly detailed 3D images of the body, which helps surgeons plan complex procedures with amazing accuracy.
So it's not just about taking pictures, it's about using those images to create data that can guide treatment.
You got it. And with AI, we can even analyze those images to find tiny changes that might be early signs of a disease.
That's amazing.
Yeah.
We talked about diagnosis and imaging, but what about behind the scenes? How is technology changing the way healthcare operates?
Operations are being totally transformed thanks to technology. Cloud computing, data analytics, and mobile tech are streamlining workflows, improving communication between providers, and taking some of the administrative burden off their shoulders.
So it's all about making healthcare more efficient, more connected, and ultimately more patient-centered.
Exactly. And we can't forget the impact technology is having on clinical research. We're seeing more virtual clinical trials where people can participate from home using wearables and smartphone apps.
That's way more convenient and accessible than traditional clinical trials.
Absolutely. This allows researchers to gather data from more diverse groups of people, which leads to more solid findings.
So it's a win for research as well. Now let's shift gears and talk about some of the truly groundbreaking innovations that are really pushing the limits of what's possible in medicine.
Oh, yeah. The speed of innovation in medicine these days is mind-blowing. We're seeing progress in gene editing, 3D printed organs, even brain-computer interfaces that allow paralyzed people to control prosthetic limbs with their thoughts.
Wait, brain-computer interfaces? That sounds like something out of a sci-fi movie.
It does, doesn't it? But it's becoming a reality. We're also seeing huge leaps forward in treatments for things like cancer, Alzheimer's, and other chronic conditions that have plagued humanity for centuries.
It sounds like we're entering a new era of healthcare where technology isn't just a tool, but a partner in our well-being.
I completely agree. And these are just a few examples. This field is changing so quickly that what seems futuristic today might be normal tomorrow.
It's incredible to think about. So speaking of the future, what are some of the digital innovations that are going to shape healthcare in the years to come?
One exciting area is connected digital care. This uses things like remote patient monitoring to let healthcare providers keep an eye on their patients' health in real time, even outside of the doctor's office.
So even if you're miles from your doctor, they can still keep track of your vital signs and change your treatment plan if they need to.
That's the idea. And AI is going to play a much bigger role in healthcare going forward. We're already seeing AI-powered virtual assistants that can answer patient questions, schedule appointments, and even give some basic medical advice.
It's like having a personal healthcare assistant available 24/7.
Exactly. And as we gather more and more health data, AI will get even better at recognizing patterns and predicting health outcomes, which will lead to even more personalized and preventative care.
So it's not just about treating illnesses, it's about stopping them before they even happen.
Precisely. We're also seeing a rise in patient empowerment, with online communities becoming crucial for connecting patients and providing support and information.
It's fantastic that people can share their experiences and learn from each other, especially when it comes to navigating the healthcare system, which can be so confusing.
Absolutely. But with all this connection and data sharing, we need to make sure digital health data security is a top priority. We're seeing some incredible innovations in data encryption, blockchain tech, and even AI-powered cybersecurity to protect this sensitive medical information.
It's like a race to stay ahead of anyone who might try to exploit that data.
Yeah, unfortunately, that's true. But luckily, we've got some of the brightest minds out there working hard to develop and implement really strong security measures.
That's good to hear. And of course, telehealth services are going to continue to grow and change. We can expect to see more virtual checkups, remote monitoring programs, and even AI-powered diagnostic tools that you can use at home. It's all about making healthcare easier to access, more convenient, and more focused on the patient.
Precisely. And it's important to remember that medical technology covers a huge range of tools and techniques, all designed to improve our health and well-being.
Okay, let's break that down a bit. What are some of the different categories of medical technologies and what are they for?
Well, we've got technologies for prevention, like vaccines, screening, like mammograms, diagnosis, like EKGs, treatment, like medications and surgery, and rehabilitation, like physical therapy and prosthetics.
It's amazing to think about all the different technologies that are out there tackling all these different parts of health, from preventing illness to restoring function after an injury.
It really is. And these technologies can be anything from pharmaceuticals and medical devices to software apps and even AI algorithms. They all have a part to play in making healthcare better and improving our well-being.
It's not just about the latest gadget. It's about taking a broad approach to healthcare that uses tech in every way possible.
Exactly. And it's really interesting to look back at how medical innovation has changed over time. We've come a long way from the days of basic tools and procedures. Remember bloodletting? That used to be standard treatment.
It's hard to believe that people actually thought draining blood was the answer to so many problems. Talking of big moments, what are some of the key milestones in the history of medical innovation that really stand out?
Well, the introduction of the smallpox vaccine in 1796 was a massive turning point. It's when we realized we could prevent diseases through immunization, and it saved so many lives.
That was a truly groundbreaking discovery.
Oh, absolutely.
Yeah.
Then in 1844, the invention of the hypodermic syringe revolutionized how we give medications.
Yeah, before that, getting medicine into someone was a lot harder and sometimes even dangerous.
For sure. The hypodermic syringe let us put medications directly into the bloodstream, which works a lot better and faster.
And of course, we can't forget about penicillin in 1929.
Penicillin changed the game completely when it came to fighting bacterial infections. Before we had penicillin, even small infections could kill you.
It's amazing how many lives antibiotics have saved. They've transformed medicine.
And it's not just about the drugs. The way medical devices have evolved has been just as incredible. We've gone from basic tools to super sophisticated imaging machines like X-rays, CT scans, and MRIs.
These imaging technologies have given us an incredible look inside the human body so we can diagnose and treat conditions much more accurately.
Absolutely. And the way we do surgery, the tools and techniques have advanced so much. Now we have minimally invasive surgery, robotic surgery, and even 3D printing, which is used to create personalized implants and prosthetics.
It's amazing to think about what surgeons can do now compared to just a few decades ago.
You're telling me. And these advances aren't just happening in fancy hospitals. We're also seeing innovations in point-of-care diagnostics, telemedicine, and wearable health trackers, all of which are making healthcare more accessible and more focused on the patient.
So it's not just about the big breakthroughs. It's about the constant stream of innovations that are improving healthcare and making us healthier as a whole.
Exactly. And we have to remember that medical innovation never stops. There's always room to do things better, and we still have so many challenges to overcome.
Speaking of challenges, one of the biggest hurdles for medical innovation is the whole regulatory process. Getting new drugs, devices, and treatments approved for use can be a very long and difficult journey.
You're not wrong. The regulatory process is there to make sure any new medical tech is safe and effective, but it can sometimes slow down the pace of innovation.
And then there's the issue of money. Medical research costs a lot, and getting funding for new projects can be a big obstacle.
For sure. We need to figure out ways to encourage investment in medical innovation and make sure that great ideas get the resources they need to succeed.
It's a complicated problem with no easy solutions, but we have to address it if we want to keep seeing healthcare improve.
Absolutely. And speaking of complicated things, we also need to think about the ethical implications of these advancements. As we develop more powerful technologies, we have to be careful about how they're used and who has access to them.
You're right. We have to make sure these technologies are used for the right reasons and that they don't make existing inequalities even worse.
Exactly. We need to be thoughtful and intentional in how we approach this and make sure we're using these advances to create a healthcare system that's fairer and more just for everyone.
Couldn't agree more. Now, are you ready for some of those strange and amazing surgical procedures we talked about earlier?
Oh, yeah. I always find those fascinating. They really show you how creative and clever surgeons can be.
Okay, let's start with rotationplasty. This is where a surgeon actually turns a child's ankle into a knee joint.
I know it sounds crazy, but it's a real procedure that can be life-changing for kids with certain types of bone tumors.
So how does it work?
Well, if a child has a bone tumor near their knee that can't be treated with other methods, the surgeon removes the part of the leg with the tumor, including the knee joint.
So they're essentially amputating the lower leg.
Yes, but here's the amazing part. The surgeon then rotates the rest of the lower leg 180 degrees and reattaches it to the thigh bone.
Wait, so the foot is now facing backward?
Exactly. And the ankle joint, which is now where the knee used to be, becomes the new knee joint.
That's mind-blowing. So can the child actually walk on this new leg?
Yes. They attach a prosthesis to the foot, and the child can walk, run, even play sports. It's really remarkable.
It's incredible how surgeons can find such innovative ways to use different parts of the body.
It is. And it just goes to show that amputation doesn't always have to be the end. There are often creative solutions out there that can help people keep functioning and have a better quality of life.
And speaking of creative solutions, let's talk about osteodontokeratoprosthesis, more commonly known as tooth and eye surgery.
Yeah, it sounds wild, but it's a truly amazing procedure that can give sight back to people who've lost their vision because of corneal damage.
Okay, so how does a tooth actually become an eye?
It's a multi-step process. First, the surgeon takes out one of the patient's canine or premolar teeth, along with a bit of the jawbone around it.
They take a piece of the jawbone too.
Yeah, the bone is important because it gives the tooth a blood supply, which is crucial for the procedure to work. Then the surgeon drills a hole in the tooth and puts a custom-made plastic lens into the hole.
So the tooth is like a base for the lens.
Exactly. And then they implant this whole structure under the skin of the cheek for a few months. This lets new blood vessels grow into the bone and tooth, creating a healthy environment for the lens.
So the cheek becomes like a temporary home for the tooth lens implant.
You got it. After a few months, the surgeon takes the implant out of the cheek and very carefully implants it into the eye, where it takes the place of the damaged cornea.
And that lets light through, restoring the patient's vision.
That's right. It's a complicated and delicate procedure, but for people who have lost their sight, it can be truly life-changing.
It's incredible what surgeons can do with a little ingenuity and a patient's own tooth.
It is, and it shows how adaptable and resilient our bodies are. Even when we face what seem like impossible challenges, there are often creative solutions that can restore function and make life better.
Now let's talk about hemispherectomy.
Right.
This one's a bit more intense, but just as fascinating.
Oh, definitely. Hemispherectomy is when surgeons remove or disconnect one half of the brain from the other half.
Wait, they remove half of the brain?
In some cases, yes. It's a very serious procedure that's usually only done for children with severe epilepsy or other neurological disorders that haven't responded to other treatments.
That sounds incredibly risky. How can someone function normally after having half their brain removed?
I know, it's remarkable, isn't it? The
Right.
brain, especially in young children, is incredibly adaptable. In a lot of cases, the remaining half of the brain can compensate for the half that's gone, allowing the child to live a pretty normal life.
So the brain basically rewires itself to adjust to the new situation.
Exactly. It just shows how amazing the brain is at adapting and healing. Of course, there are risks with hemispherectomy, and it's not a decision that's taken lightly. But for some kids, it can be a life-changing procedure that really reduces seizures and improves their quality of life.
It's a reminder that even when faced with seemingly impossible challenges, there are medical interventions that can offer hope and better outcomes.
Absolutely. Medical science is constantly pushing the limits of what's possible, and it's a really exciting time to be seeing these advancements. Now, before we move on to some truly unusual surgical procedures, I want to give a shout out to London Heartbeat Z Academy, our sponsor for this episode.
They're an amazing resource for anyone who wants to learn more about the fascinating and constantly changing world of healthcare. They have over 140 courses on all sorts of healthcare topics.
And the best part is you can find a lot of their stuff for free on their social media channels. Make sure to follow them on Facebook, Instagram, Spotify, and YouTube so you don't miss out.
We'll tell you more about London Heartbeat Z Academy at the end of the episode. But for now, let's dive into some surgical procedures that sound like they're straight out of a science fiction novel.
Oh, I love these stories. They really showcase the ingenuity and creativity of surgeons.
Okay, so let's start with rotationplasty. This is where a surgeon takes a child's ankle and turns it into a knee joint.
It sounds unbelievable, but it's a real procedure that can be life-changing for children with certain types of bone tumors. Basically, if a child has a tumor near their knee that can't be treated any other way, the surgeon removes the affected part of the leg, including the knee joint.
So they basically amputate the lower leg?
Right, but here's the crazy part. The surgeon then rotates the remaining part of the lower leg 180 degrees and reattaches it to the thigh bone.
Wait, so now the foot is facing backward.
You got it. And the ankle joint, which is now in the spot where the knee used to be, becomes the new knee joint.
That's amazing. And the child can actually walk with this.
They can. They attach a prosthesis to the foot, and the child can walk, run, even play sports. It's truly a remarkable procedure.
It's amazing how surgeons can find these innovative ways to use different parts of the body.
It really is. And it shows that amputation isn't always the end of the road. Often there are creative ways to help people keep functioning and have a better quality of life.
Okay, that one was mind-blowing. Now, how about this one, osteoodontokeratoprosthesis, also known as tooth-in-eye surgery?
I know, right? It sounds crazy, but it's a truly incredible procedure that can restore sight to people who have lost their vision due to corneal damage.
So how does a tooth become an eye?
Well, it's a process that has several steps. The surgeon starts by removing one of the patient's canine or premolar teeth, along with a little piece of the jawbone that surrounds it.
They take out a piece of the jawbone, too.
Yep, the bone is crucial because it provides a blood supply to the tooth, which is essential for the success of the whole procedure. Then they drill a hole in the tooth and insert a custom-made plastic lens into that hole.
So the tooth acts as a sort of base for the lens.
Exactly. Then this whole structure is implanted under the skin of the cheek for a few months. This allows new blood vessels to grow into the bone and tooth, which nourishes the lens and helps it thrive.
So the cheek becomes like a temporary incubator for the tooth lens implant.
You could say that. After a few months, the surgeon retrieves the implant from the cheek and very carefully implants it into the eye where it replaces the damaged cornea.
And this allows light to pass through again, restoring the patient's vision.
That's right. It's a complex and very delicate procedure, but for people who have lost their sight, it can truly change their lives.
It's incredible what surgeons can do these days. With a bit of ingenuity and a patient's own tooth.
It really is. It reminds us that our bodies are incredibly adaptable and resilient. Even when faced with what seem like insurmountable challenges, there are often creative solutions out there that can help restore function and improve quality of life.
Now, this next one is a bit more intense, but equally fascinating. It's called hemispherectomy.
Oh, yeah. Hemispherectomy is a surgical procedure where they either remove or disconnect one half of the brain from the other half.
Hold on, they remove half of the brain.
They do in certain cases. It's a pretty radical procedure that's typically only used as a last resort for children who have severe epilepsy or other neurological disorders that haven't responded to other treatments.
That sounds incredibly risky. How is it even possible for someone to function after having half their brain removed?
I know, it seems unbelievable, right?
Hmm.
But the brain, especially in young children, is incredibly plastic, meaning it can adapt. And in many cases, the remaining hemisphere of the brain can compensate for the functions of the missing half, allowing the child to live a relatively normal life.
So it's like the brain rewires itself to adapt to the new situation.
Exactly. It really is a testament to the brain's amazing ability to adapt and heal. Of course, there are risks associated with hemispherectomy, and it's not a decision that's made lightly. But for some children, it can be a life-altering procedure that dramatically reduces seizures and greatly improves their quality of life.
It just goes to show that even in the face of what seem like impossible challenges, there are medical interventions that can offer hope and make things better.
Absolutely. Medical science is always pushing the boundaries of what's possible, and it's a really exciting time to be witnessing these advancements. And speaking of exciting advancements, let's circle back to our sponsor for this episode, London Heartbeat's Z Academy.
They're doing such amazing work in healthcare education, and we highly recommend checking out their over 140 healthcare courses.
You can find them on their website, and be sure to follow them on Facebook, Instagram, Spotify, and YouTube for free updates and to hear about future discussions. You don't want to miss out on their incredible content.
They're truly a treasure trove of knowledge for anyone interested in healthcare.
Yeah, it really is amazing to see just how far we've come in medicine and, the pace of innovation is just getting faster and faster. But with all this progress, it makes you wonder where we're headed.
I know what you mean. It's not just about what we can do with healthcare technology, but also the how and the why.
Right. As we create these powerful technologies, we have to think about how they'll affect society. We need to make sure they're used ethically and for good.
I totally agree. This is a conversation we all need to be having, scientists, engineers, policymakers, even the general public.
Absolutely. We need to think about the good and the bad and make sure everyone can benefit from these advancements.
That's so important. We don't want a healthcare system where only the wealthy can afford the latest technologies.
Exactly. We should be aiming for a future where everyone benefits from innovation, regardless of their background or how much money they make.
So it's not just about the tech itself, it's about how we use it and who has access to it.
Couldn't have said it better myself.
Yeah.
We need to be smart and careful and make sure these technologies are making healthcare fairer and more just for everyone.
Now let's take a step back and look at the history of medical innovation. It's amazing to see how far we've come.
Oh, it really is. When you think about the innovations that have completely changed healthcare over the centuries, it's mind-blowing.
So let's rewind a bit. What are some of the big milestones that have shaped medicine?
Well, we have to start with the smallpox vaccine in 1796. It was a game changer. That's when we realized we could actually prevent diseases by giving people immunizations. It saved countless lives.
It's hard to overstate the impact of vaccines on human health. Think of how many lives they've saved and how many diseases they've eradicated or at least controlled.
Totally. And then in 1844, we had the invention of the hypodermic syringe, which completely changed how we give people medication.
Yeah, before that, giving medicine was a lot harder and often risky.
You're right. The hypodermic syringe meant we could deliver medications right into the bloodstream, which is much more efficient and effective.
And of course, we can't forget about penicillin in 1929.
Oh, yeah. Penicillin was huge. It changed everything when it came to treating bacterial infections. Before penicillin, even a minor infection could kill you.
It's mind-boggling how many lives have been saved by antibiotics. They've revolutionized medicine.
And it's not just about drugs either. The evolution of medical devices has been just as amazing. We've gone from simple tools to super advanced imaging machines like X-ray CT scans and MRIs.
Those imaging technologies have given us a window into the human body that we never had before, so we can diagnose and treat conditions much more precisely.
Absolutely. And the way we do surgery, the tools and techniques have come a long way too. We have things like minimally invasive surgery, robotic surgery, and even 3D printing, which they use to make custom implants and prosthetics.
It's incredible to think about what surgeons can do now compared to even a few decades ago.
I know, right? And these advancements aren't just happening in high-tech hospitals either. We're seeing cool new stuff in point-of-care diagnostics, telemedicine, and wearable health trackers, which are all making healthcare easier to access and more focused on the patient.
So it's not just about the huge breakthroughs, it's about all the smaller innovations that together are improving healthcare and making us healthier.
That's it exactly. And it's important to remember that medical innovation never stops. We can always get better, and there are still so many challenges ahead of us.
Speaking of challenges, one of the biggest obstacles for medical innovation is the whole regulatory process. It can be a long and difficult road to get new drugs, devices, and treatments approved.
Oh, yeah, that's true. The regulatory process is there for a reason to make sure anything new is safe and works properly, but it can definitely slow things down sometimes.
And then there's the whole funding issue. Medical research is expensive, and getting the money for new projects could be a big hurdle.
Absolutely. We need to find ways to encourage people to invest in medical innovation and make sure that promising ideas get the support they need to succeed.
It's a complex problem with no easy answers, but it's something we have to address if we want to see healthcare continue to improve.
I couldn't agree more. And while we're talking about complex issues, we also need to think about the ethical side of these advancements. As we create more and more powerful technologies, we have to be really careful about how they're used and who has access to them.
You're absolutely right. We need to make sure these technologies are used for the right reasons and that they don't end up making existing inequalities even worse.
Exactly. We need to be thoughtful and deliberate in our approach and focus on using these advancements to create a healthcare system that's fairer and more equitable for everyone.
Well,
Free by following them on social media. Be sure to check out their Facebook, Instagram, Spotify, and YouTube channels for updates and discussions. You don't want to miss out on their amazing content.
it's really inspiring to see how medical science keeps pushing the boundaries of what we thought was possible. But with all this progress, we have to think about what it all means. What are the implications of these advancements?
I agree. As we get deeper into things like gene editing, artificial intelligence, and other cutting-edge technologies, we need to be having honest conversations about the ethics of it all.
It's not just about what we can do, it's about what we should do. We need to be sure these technologies are used responsibly, ethically, for the benefit of all humankind.
Absolutely. We need to think about how this will affect people, communities, and society as a whole, and we have to make sure everyone has access to these technologies, not just the wealthy.
Exactly. It's a complex challenge with many different sides, but it's one we can't ignore if we want a future where everyone has access to quality healthcare.
Well said. I think that's a perfect point to wrap things up. We've covered a lot in this deep dive into healthcare technology and all the amazing medical innovations happening right now.
It's been an incredible journey, from the basics like electronic health records and telemedicine to the incredible potential of things like AI and gene editing. The future of healthcare is full of possibilities.
It really is an exciting time to be working in this field, and for anyone who wants to learn more about healthcare and all the changes happening, London Heartbeat Z Academy is an amazing resource.
They're an incredible resource for anyone who's interested in learning more about healthcare. They have over 140 courses on all kinds of topics, from the basics of how the body works to the latest advancements in medical technology.
And you can access a lot of their content for free by following them on social media. Check out their Facebook, Instagram, Spotify, and YouTube channels for updates and great discussions.
You don't want to miss out on their incredible content. So as we finish up this episode, we encourage you to think about all the incredible advances we've discussed today, and maybe even how you can be a part of shaping the future of healthcare.
The future of healthcare is in our hands. It's up to all of us to make sure these advancements are used wisely and ethically to create a healthier and more equitable world for everyone. Thanks for joining us on this deep dive.